thanks for coming in for the interview today. I have a couple questions for you. The first question I have is, what areas or area of nursing are you interested in and why?
I'm interested in pediatric nursing mainly. I was a pediatric nurse in a doctor's office for 3 years prior to working where I work now, and currently I work with pediatrics and adult patients. I just really enjoy working with kids, and I enjoy the challenge that pediatrics gives me.
All right, tell me about your clinical experiences. Which rotations did you enjoy the most and why?
I've had multiple clinical rotations. My first one was a mental health rotation at Northwest Hospital. I did enjoy that. It was definitely interesting, always changing. I also did a rotation in the emergency department at Northwest Hospital, which was really cool as well. And I enjoyed the change of pace and how different everything was that came in. How it was always something new to see. I also did a med surg rotation at the emergency room at Anne Arundel Medical Center. That was definitely one of my favorite rotations. I learned a lot, lots of hands on, definitely improved my skills in the ER there, and it was just always changing. I always got to see something new and different.
All right, what would you say is the biggest mistake you ever made and how was the problem resolved?
The biggest mistake I think I ever made in my nursing career would be where I work now, allergy shots. It's kind of like different dosing that we have to give, and it's increasing doses. And the only time I can only think of a mistake would have been drawing up the wrong amount. And then when we have it checked, I realized that I made a mistake and drew up the wrong amount. So instead of 0.05, it was zero point 0.5, which is a lot more than what it should be. But luckily, it was caught by another nurse before he gave it, so no harm was caused during the mistake.
All right, tell me about yourself. What do you see as your strengths and why?
A strength for me would be I think that I'm very organized. I'm very good with my time management as well. I can manage a lot of things at once without getting stressed out. Definitely can work in a really fast-paced environment.
Okay, how about your weaknesses?
My weakness would be that I'm a perfectionist, or at least I feel like that's a weakness. I always strive to be the best that I can, and sometimes I feel like I just push myself too hard because I want everything to be perfect.
Tell me about your staff nurse who most impressed you and why.
I would say that the preceptor that I worked with during my last rotation, she was really, really great. She was very hands on with me and showing me how to do things and giving me the opportunities to care for the patients. She was also an awesome leader, took charge of situations, and really showed me what a great nurse should be.
Okay. How would your most recent nursing instructor describe your performance in the clinical setting?
I would say excellent. I'm definitely a hardworking student and a hardworking employee. I try my best every day. I come to the job on time, don't make mistakes, and I'm willing to do anything and willing to learn anything.
Tell me about your most challenging clinical assignment and what you learned from it.
For me, my most challenging clinical assignment would be a patient that I recently had in the emergency room. She was a patient who was in for a possible overdose on Benadryl and alcohol, and she was on BiPAP. The patient started vomiting and then coded, and she also aspirated some of the vomit. So, what I learned from this situation was just that there's a lot going on at once when a patient codes. It's also a good learning experience that I learned that patients who are at risk for vomiting should not be on BiPAP because there's always that risk for aspiration with the BiPAP.
All right, the next question is, what skills do you feel you have gained from your past work experience that may help you in this position?
I think I've gained a lot of experience in my past two jobs. I'm really, really good with kids. I administered vaccines at my previous job. I had to work with families and parents as well as infants the whole way up to 18-year-old children. At my current job, I manage three other people in the office, and I also coordinate care with the doctors on different policies and procedures, and I also work with my nurse manager in coming up with policies and procedures for the office. I also am in charge of ordering and doing everything for the office, so I feel like I'm very organized. I'm very good with my time management skills. I'm very good at organizing everything that needs to be done in the day and keeping everyone on task.
Okay, could you tell me a little bit about yourself and how others describe you?
I would think others would describe me as a very organized person. I'm always on time. I'm also very effective at my nursing skills and what I do. I'm also a perfectionist, so I strive to make everything the best that I can make it in the office.
All right, what are your future career plans? Where do you expect to be in 2 to 3 years or even in 5 years?
For me, my future career plans include going back to school to complete my BSN. I want to do that sooner than later, and I want to stay at a job where I can be at for a while. So I'm looking for a job that I can grow at and kind of build up in my career.
Okay, what we do not have any openings in the present time in the area in which you are indicated an interest. Would you be willing to accept a position in another area? If so, what other areas are you interested in?
For me, I'm interested in emergency room nursing as well. I feel like that was a very interesting rotation for me, and I really did enjoy the emergency room. I'm also interested in NICU positions. I really enjoy working with kids, which I talked about before, and I really like a challenge, and I think that the NICU would also give me a challenge. It would also give me a chance to increase my skills.
Could you tell me about a time when you had to establish priorities during one of your clinical experiences?
I think that I had to establish priorities every single day during my clinical experience. But definitely in the emergency room, you definitely have to, organize your priorities, working from the patient that's the sickest down to the patient that's not. Also have to organize your time to prioritize who's going to be discharged, what meds need to be given now. So definitely the ER experience has given me a good grasp at prioritizing my patients and prioritizing care.
Okay, and the last question we have is, could you tell me about a time when you went out of your way to assist a family or patient, even though you really did not have the time?
In the emergency room, for sure, that's given me experience with working with families. In the emergency room, patients come in, they're usually really sick, or it's something that's definitely urgent that they're there that they need to be treated for, and the families are typically upset or frightened. So I feel like I went out of my way the other day for a patient and made sure that the family was comfortable. I provided them with drinks and snacks, and even though that I was really busy with another patient who was being worked up for a possible heart attack, I still took the minute to grab them the snacks on my way back to the other room when I was grabbing something else that I needed for that room.
All right, well, that concludes our interview, and thank you for coming in today.
Thank you.